All right, now hopefully I'm going to turn down the volume on this one a little bit. This is going to be much of a review probably from what you've had in your anatomy and physiology course. When we talk about movement and kinesiology, we have to have a good understanding about what bones are moving and what muscles are causing those bones to move. So we're just going to go through some very basic information about the skeletal system at this point, and then each time we do a different part of the body, we're going to learn about those specific bones that are involved at that particular area of the body. There are four key concepts that are very important to know about bone. First and foremost, your bones provide shape and support to the body. Without them, we would fall to the ground sort of in a blob, right? Next, bones are important because they do protect certain vital organs. If you consider where the ribs are situated, they protect your heart, your lungs, some other very important parts of your body. Your pelvis also protects very vital organs in that area. Your skull protects your brain, your vertebral bones protect the spinal column. So those are important to protect those vital organs. Third thing is that bones are assistive in movement. They provide muscle attachment. The MM stands for muscles. Muscle attachment and which create the ability to produce leverage. So without something solid to hold onto, the muscle would have a difficult time producing much strength. The final thing is that bones are important for manufacturing blood cells. Now, a couple of other details that your book touches on. There are 206 bones in the body, and there are different types of bone. There is something called compact bone, which is very hard and dense, like in the shaft of your femur. It's a very hard, thick, dense piece of bone, and there are, however, other areas of bone that are called cancellous. Cancellous bones are very porous, almost look like spongy. These are bones that are, or areas, parts of bones that are much more prone to breaking. They are important though in some respect because cancellous bones are much less heavy, much lighter in weight. As we think about the structure of bone, we're going to go through this in class. If you need some additional help, there's some nice pictures in your textbook that are going to help to reinforce your learning about the different parts of the bone. If you look on page 15 in your text, you can find those. The epiphysis is the very end of the bone. The epiphyseal plate is where is an area of cartilage that is in between the end of the bone and where then the metaphysis begins, and that is your growth plate. The diaphysis is the main shaft of the bone. Oop, I have forgotten to push my buttons there, so sorry. And it is a very hollow center, and that is where the marrow lives. The metaphysis is called the neck of the bone. That is an area of cancellous bone. Now, that's a very important part of the bone to understand, particularly when we think about something like the femur. When somebody falls and breaks a hip, they typically break in that area because of that cancellous bone, that sort of porous bone that breaks much more easily. The periosteum is a thin membrane that covers the outside of the bone, and it contains your nerve supply and your blood supply. And so bone itself does not have nerve supply, the periosteum does. So a fracture of a bone is not what hurts, it is the nerve supply that causes the pain. Let's see, what else can I tell you about that's not on here? There's also a medullary canal, which is that hollow shaft area, and that is in the center of the diaphysis, and that is, as I mentioned, an area where the passage of nutrients occurs. And I think that is about what I want you to know with the structure of bone. There are several different types of bones, and we'll go through some of these in class. There are long bones that are things like the humerus. They tend to be longer than they are wide. There are short bones, which are more cubical, more sort of square, even on all sides. The height, width, and length tend to be similar. And a good example of that would be the carpals. There are flat bones in the body, very broad surfaces and not thick at all, like the scapula. There are irregular bones, like the vertebral bones, which really don't have any rhyme or reason to how they're shaped. And then there are sesamoid bones, and bones are seed-shaped bones. Now, probably the most um, commonly known sesamoid bone is the patella or your kneecap, but we're going to discuss other sesamoid bones as we go through different parts of the body. Again, it is important to understand that bones are very important for producing good leverage and pull um, that muscles and tendons can create. They need a nice stable surface. However, sesamoid bones are going to be super important because they actually change the line of pull of a muscle and they produce a better what's called mechanical advantage. So we'll talk more about that. It's almost like a pulley system. So here's an example of a long bone, the humerus, and your short bones or your carpal bones, which we have 8 of, and you know that by now, hopefully. Uh, Sesamoid bones here, pictured here, and then the irregular bones like the vertebral bones. Now, there are some pathological things to know and understand from a clinical perspective. Most of us are pretty familiar with osteoporosis. Osteoporosis is something that tends to show up as we age, and it is a reduction in the quantity of bone or an atrophy of the skeletal tissue. So, osteoporosis can be not prevented, but the incidence can be reduced through good diet and through good weight bearing through your bones. Osteomyelitis is an inflammation of the bone marrow and the adjacent bone, and typically is caused by bacteria that we see associated with something like a fracture. Osteoarthritis is another one of those things that tends to come on with age. That is an erosion of the cartilage in between in the articular surface in the joint, and it's pretty common. Osteoarthritis is one of the most common pathologies of people who are older. Um, and then, as we know, fractures are breaks in the bone, and we're going to take a look at a variety of interesting types of fractures in class. Well, not in here, but in class. Okay, so how do we look at pathology in the skeletal system? We might be using an X-ray, which uses radiation that creates a black and white picture of the bone. I don't think there's anybody who's not familiar with that. We might use a bone scan, or we might see somebody who's had a bone scan done in which there's been an injection of radioactive material that really sort of lights up certain areas on something like an X-ray. There's a CT scan. CT stands for computed tomography, and it shows like a cross-sectional picture. It takes various thin sliced pictures to show what's going on at different parts of the body. Or there's an MRI, which is also called a magnetic resonance imaging. Magnetic field actually lines up at a cellular level, lines up the protons and electrons and creates a visual image of the anatomy. Here's an interesting picture. This is an open reduction external fixation. So we also call this contraption. You can see that it protrudes to outside of the arm. That is called an external fixator. So that would be used when something like a cast would not be effective to to help a set of bones remain in alignment so that they can heal. This is called an ORIF, an open reduction internal fixation. This is when pins and plates are put in place and they are actually under the skin. You can't see them on the outside, and this is something that's very typically used with something like a hip fracture. Percutaneous pinning is a series of pins that are put into place, and they hold the bones in place so that they can heal. And one thing that is interesting to know, when you see something called a closed reduction would be something where there's not an excessive amount of stuff sticking outside of the skin. So something like a cast would be a closed reduction, okay, where they don't go in surgically and put things in place beneath the skin so much. This is a little different with the pinning, but the pinning is interesting. Here's what the pinning looks like on the outside. Looks like some straight pins there. So